Hello and welcome. Today we're diving into a critical urological condition known as bladder tamponade. This is a serious situation where the bladder fills with blood clots, essentially stopping it from functioning properly. We'll explore what causes it, how it affects the body, and the methods used to diagnose and treat it. So, what causes bladder tamponade? The primary culprit is often bleeding within the urinary tract. This can stem from a variety of sources. Common causes include trauma to the pelvis or bladder, perhaps from a car accident or fall. Other contributing factors can be recent bladder surgery or procedures, such as a cystoscopy or TURBT. Furthermore, certain medical conditions like bladder cancer, radiation cystitis, or even severe urinary tract infections can lead to significant bleeding and, subsequently, bladder tamponade. Less common causes include blood clotting disorders and medication side effects. Let's talk about the pathophysiology. Imagine the bladder as a balloon. Normally, it fills with urine, and you empty it when it's full. In bladder tamponade, bleeding occurs inside that balloon. The blood clots, and these clots start to accumulate. The accumulating clots prevent the bladder from fully expanding or contracting. This means urine can't effectively enter the bladder, and even if it does, it can't be expelled. The pressure builds up inside the bladder, causing pain and potentially damaging the kidneys if the backflow isn't addressed. While specific epidemiological data on bladder tamponade is limited, it's generally considered a relatively rare condition. It's more commonly seen in patients who have undergone urological procedures or those with pre-existing conditions that predispose them to bleeding in the urinary tract. Individuals with bladder cancer, hematological disorders, or those on anticoagulation therapy may also be at a higher risk. What are the signs and symptoms that indicate bladder tamponade? The most prominent symptom is the sudden inability to urinate, often accompanied by severe lower abdominal pain or pressure. You might notice blood clots passing from the urethra, or experience a constant urge to urinate without being able to void. In some cases, patients might experience symptoms of urinary retention, such as a distended bladder palpable upon physical examination, or even signs of kidney dysfunction due to backflow. Diagnosing bladder tamponade involves a combination of clinical assessment and diagnostic imaging. A thorough medical history and physical examination are crucial. Imaging studies like a CT scan or ultrasound of the abdomen and pelvis can help visualize the bladder and identify the presence of blood clots. A cystoscopy, where a small camera is inserted into the bladder, allows for direct visualization of the clots and can also be used to help with treatment. A urine analysis will typically show significant hematuria, blood in the urine. While there aren't distinct types of bladder tamponade, the severity can vary based on the amount of bleeding and the size of the clots. It can range from a partial obstruction, where some urine flow is still possible, to a complete obstruction, where no urine can be passed. The primary goal of treatment is to relieve the obstruction and stop the bleeding. This often involves a procedure called bladder irrigation, where a catheter is inserted into the bladder and sterile fluid is used to flush out the blood clots. In more severe cases, a cystoscopy may be required to manually remove large clots. To address the underlying bleeding, medications like aminocaproic acid or tranexamic acid may be used to promote blood clotting. If the bleeding is due to a specific cause, like a tumor, that condition will need to be treated accordingly. In rare cases, surgical intervention may be necessary. Preventing bladder tamponade largely depends on managing the risk factors. For patients undergoing urological procedures, careful surgical technique and post-operative monitoring are essential. For individuals with conditions that increase bleeding risk, close monitoring and appropriate management of those conditions are crucial. This includes careful management of anticoagulation therapy and prompt treatment of urinary tract infections. The prognosis for bladder tamponade is generally good with prompt diagnosis and treatment. The majority of patients experience complete resolution of their symptoms. However, recurrence is possible, particularly if the underlying cause is not adequately addressed. Recent research focuses on improving techniques for clot removal and minimizing the risk of bleeding during urological procedures. Newer medications are also being explored to better control bleeding in the urinary tract. It's important to follow up with your doctor to monitor your condition and prevent future occurrences. Thank you for watching.